Thanks so much for joining us today. First, I wanted to ask about the letter that you sent along with your colleague, Senator Stennett, to the majority leaders, the Speaker and the President pro tem, about your concerns about the session.
Yeah, we have pretty substantial concerns about session. We had concerns, frankly, about the special session in August and the lack of safety protocols there. But we're in a much more dire situation right now than we were in August. Since then, our numbers have gone through the roof. We're facing critical care standards, which is basically death panels, right? It's rationing of care. It's turning people away because our hospitals and our ICUs are so overfull that they will not be able to give care to everybody. National numbers are appalling. We're regularly breaking 3,000 a day in deaths. We are in a raging, dangerous phase of the pandemic, and the session that's being proposed to start in a couple weeks, at almost the worst possible time. It'll be right after Christmas, so we'll have an even worse spike after Christmas gatherings. It seems to me almost exactly what every health care professional in America would say to not do, right? It's, bring people in from all over the state, pack hundreds of people into a closed indoor space, most of them not wearing masks, no distancing protocols, and then send them home on weekends to bring back whatever it is they caught in session. And it just is, it's so imprudent, and it feels so unnecessary. Vaccines have been approved. They're on the way. They are on trucks on the way to Idaho. If we just wait a little while, we can be in a so much better, much safer situation. And we can do all the work we need to do in a couple months. We can pass budgets in plenty of time for the new fiscal year. And I think, frankly, we would do a much better job. I like having people in the building. I like having people in person advocating for what they care about. And we can have that if we just waited a little bit. And it's perfectly doable under the rules and under our Constitution. So we felt it was really important to put it out there so that people know that this is a very viable option. And hopefully the majority party would listen, although it appears they're not. They're not interested in doing that.
Right. Let's talk about that because there might be an avenue to do it, but there doesn't seem to be an appetite to do it. We've heard now from both Speaker Bedke and the Senate President Pro Tem Winder have told the media that that's just not an option, at least at the beginning of the session. So, with that in mind, what are you going to do?
Well, I mean, right. And some of the things I did take issue with some of their response in that, there was sort of an implication that it just wasn't doable, that our Constitution and the rules require that we go full on starting January 11th. And I just don't think that's the case. First of all, we could change the rules to allow people to go remotely. Yes, it's a 2/3 vote. We often do that 3 times a day in session to suspend rules and vote on a bill a day early, or, there's all kinds of areas where we suspend or change the rules. So, we could pass something with a 2/3 vote if they wanted to. However, we could also pass a resolution to adjourn, which only requires a simple majority vote. So you would not need a 2/3 majority for that. Yes, we have to show up on January 11th, but we could show up on January 11th, quickly pass a concurrent resolution and adjourn for a couple months, and then come back and do really fulsome business where everybody can be in things safely and testify and do the whole shebang. So I think there is very much a constitutional and viable procedural alternative to postpone, but they just don't want to. And I think that's what people, it's just a choice. It's just a political choice. So we will just do the best we can under the circumstances. We will, of course, wear our masks, do the best we can to proceed as safely as we can. But, when you're in a room with 70 unmasked people, not sure that wearing your own mask is really enough. But beyond that, there's concerns for staff, the public. A very large amount of the public won't feel safe coming in to advocate. Maybe they can do some Zoom testimony, but it's really not going to be quite the same thing. So it's, journalists certainly concerned for our friends in the press corps, that's an incredibly important service to the people of Idaho to even know what's going on in there. And if our, members of our press corps don't feel confident being in the building and in rooms, I think that's a problem for people. And if we're contributing to community spread, even if we legislators don't catch it ourselves, which we might. So look what happened in New Hampshire, where the Speaker of the House died of COVID that he contracted at a session, which is pretty horrific. But it's, the more people get it, the more we contribute to community spread, the likelier it is it's going to hit somebody who has a pre-existing condition, that it's going to hit somebody in a senior living center, and somebody who's going to have really serious effects, if not death. And I think that we really should not be contributing to that problem as leaders of the state. But we'll do our best. We'll comply, on the Democratic side, at least, we'll comply with health recommendations to the very best of our ability.
One of the things that the Speaker of the House told Betsy Russell of the Idaho Press was that if some of the advocacy groups were concerned about access, that perhaps a lawsuit was a possibility. Have you heard about any plans to sue over the legislative session?
I've heard murmurs. I haven't seen anything in writing. I haven't seen anybody with a drafted complaint or heard anybody say affirmatively they're planning to. I think it's unfortunate that, that it should take that. When we know that this is, the complete antithesis of all health recommendations in a time of crisis in Idaho, I would hope that would be enough for us to voluntarily take the action without having to be sued. And I was disappointed at the response that, well, maybe if we see a major crisis in the legislative community itself, I hate to think that we're going to wait until, a member of our staff or a member of our legislature gets sick and or dies to be willing to act. When we know there's a manifestly dangerous situation, I would hope that would be enough for us to act and not have to wait till tragedy strikes. But unfortunately, that seems where we're headed.
Now, I'm curious about the legislative agenda for this session. We've heard a lot from the majority party about how they plan to address some of the governor's executive power, perhaps some policies regarding health districts and what they're able to do. What is on the docket for the minority party?
Well, certainly we want to, make sure that there does remain an ability for those in places like health districts to continue to have some ability to act when there's a major public health emergency. So I hope that we're not going to see the complete erosion of powers of those who really do need to be able to act to protect the public and to render them powerless. So I anticipate there will be some responsive component there to make sure that there is still some ability for those in these positions to protect the public. We really want to do some of the things we wanted to do last session, but weren't able to. We had a lot of bills to cut property taxes, which I think continues to be a problem for people. And to do so in a manner that leaves vital services intact. So we have a lot of proposals to reduce property taxes that don't, wipe out paramedic services, or that, that was the problem we had last session, where a lot of the proposals that dealt with property taxes did so by making deep cuts to vital county services. We have a lot of proposals that won't do that, including restoring the indexed homeowners exemption, better utilization of impact fees, using internet sales tax funds. We front. Certainly protecting Medicaid expansion and Medicaid funding is a big issue, because I know there's going to be an assault on that front. In fact, I've even heard some proposals to repeal Medicaid expansion entirely. We have deep concerns about that, given that we're in an unprecedented health emergency and a lot of people have lost their jobs. And we're certainly going to fight for those people who have lost their jobs to not also lose their access to health coverage. Proactively, we have some things in criminal justice reform, including a clean slate bill to provide a path for people to clean their criminal records for relatively minor offenses. We have some foster care legislation to allow people who wish to remain in the foster care system until age 21 instead of 18, which it is, and which some states allow. Restoring the education funding cuts is on our agenda. I have some election reform legislation in the works to make sure that people are notified if and when their ballots are thrown out for a technical difficulty. We have a lot in the works. And so, we'd like to see a really fulsome session. We would like to see a real session with real hearings and people showing up and testifying. And that's also part of the reason we'd like to see it postponed, because we think we'll be able to have a much more robust discussion about a lot more issues if everybody's feeling comfortable and safe in there.
You brought up Medicaid expansion, and I wanted to ask about the budget on that. One of the concerns when voters did vote to expand Medicaid was that the budget would be more than what was initially anticipated. And we saw that in states like Montana that expanded Medicaid before we did. Is there a concern that there's not going to be an appetite to fully fund Medicaid expansion when those bills came in more than what was initially pitched?
Well, I think we're in pretty unprecedented times, and the fact that it's over budget right now shouldn't shock people. We're in a once in a century health emergency with, overflowing hospital, overflowing ICUs. We're also facing record unemployment with all kinds of business closures, and a lot of people losing their jobs. So a lot more people have had to enroll in Medicaid expansion because they've lost their jobs and are in an economic crisis. To me, that says, thank goodness we did Medicaid expansion. Can you imagine if all of these people who have just lost everything and lost their jobs and are struggling to keep a roof over their heads also had their health care pulled away and contracted COVID and had to go to an emergency room, we would be losing rural hospitals right and left if they suddenly had this ocean of people turning up for expensive ICU care with no insurance. It would be a genuine catastrophe if we didn't have Medicaid expansion right now. And I am concerned that there will be those who try to defund it. But frankly, I think we have to recognize these are emergency times and this is not the time to pull the net away from people. I think when things normalize, we won't see this kind of budget overrun. But also right now, we're not facing a budget crisis. We're facing a healthcare crisis. We're facing an unprecedented healthcare crisis. We have $600 million in our rainy day fund that we haven't touched. We have another $500 million in budget excess. The state is sitting right now on an extra $1 billion beyond what it budgeted to have. And we have people in dire need that are losing jobs, that are losing everything, in many cases losing their homes. I mean, just in desperate financial circumstances that are facing deadly illness. This is not the time to pull that healthcare away because this health emergency has caused it to go over the projected budget. We've got to make sure that safety net stays there for people. And I hope that the legislature would not be so tone deaf as to pull away unemployed people's healthcare coverage at a time when they're facing hospitalization and a deadly virus. I'm sure we'll have to have that fight.
But there are certainly economic concerns too in Idaho. Even though Idaho is doing well economically, there are still people who are lining up at the food bank. There are still people who are not employed, at least as fully as they were before the before the pandemic. And so with that in mind, when you're looking to restore cuts for the schools, when you're looking to fully fund Medicaid expansion, when it's come in above budget, when you're fully looking at doing some of the deferred maintenance on transportation, does something have to give? And if so, what is it?
Well, again, we have over $1 billion for precisely this circumstance. We have been diligently saving and putting away budget surpluses every year. And I'm very pleased that Idaho does not do deficit spending. I'm against deficit spending, and I think we do need to be fiscally responsible. But the idea behind socking away those surpluses is precisely for times like this. It's precisely so that when the state hits a real emergency of unprecedented proportions, that we are able to keep the trains running, not literal trains, we don't really have trains in Idaho, at least not passenger trains, but to keep vital systems running, to make sure that our schools are still operating properly and safely, and that we're still paying educators an amount that will enable them to stay in the profession, and that we are still providing people access to life-saving care who've lost their jobs. This is the time. This is the reason we've been saving. This is the reason we've been running surpluses and putting it away. And so, when that crisis hits, to say, oh, never mind, we're just going to keep all that money in the bank and throw you all off your health care and, throw schools under the bus and cut their funding when we're already 51st in America on education funding. It makes no sense to me. And we already direly underfunded our schools before this, and now we've taken money away. And at a time when it's more challenging for them to operate than ever, when we're asking teachers to do more than ever, teach in sometimes dangerous situations, learn new skills, teach online, teach in hybrid scenarios that they've never had to deal with, enforce distancing and hand washing and all of this in schools that they've never had to deal with before, and put their own health on the line. We're asking our already underpaid teachers to do more and take on more personal danger than ever before, and to cut education funding right now when we don't have to, when we have over $1 billion sitting there that we save for a time like this, for a rainy day, and it is raining. It just doesn't make sense right now to be harming vital systems when we don't have to. And this will pass. This is not going to be a long-term thing. We're not going to be in a pandemic forever. Within a few months, there will be widespread vaccines available. We'll be able to reopen schools. We'll be able, restaurants will be able to reopen. We will be back on track soon. So we just need to not do irreparable damage to our government and our economy and our society in the meantime.
All right. House Minority Leader Ilana Rubel, thank you so much for your time.
Thank you. Always a pleasure, Melissa.